Here we go. Dr. Mateo P. Banegas is an associate professor and co-director of the Center for Health Equity, Education, and Research in the Department of Radiation Medicine at the Applied Sciences at UCSD School of Medicine. Trained as a health services researcher with an emphasis in cancer prevention and control, Dr. Banegas uses quantitative and qualitative methods to investigate the intersection between healthcare delivery and costs, social determinants of health, and health outcomes for individuals diagnosed with cancer. He'll be covering a lot of this, and by the way, he's super loose, so like if you have a question you want to ask in the middle of his prezo, he's all about that. He likes to have a little bit of fun, and just to tell you a little bit about how rad this guy is, he's born and raised in New Mexico. He can verify that it was in fact a weather balloon. He has 2 daughters, and he's afraid of heights. His most embarrassing moment when he himself, as a regular, quote unquote, bodyboarder, had to be Baywatched out there on the beach and get rescued. Ladies and gentlemen, Dr. Banegas.
That was super embarrassing. My older daughter, 9, was like, "Where were you, Dad?" I was like, "I was getting rescued." But they did their job. So honestly, I'm happy to answer any questions. If you see something or hear something I say, speak out. We can have a discussion about it. I don't need to finish my slides. You'll have them. You'll have access to them. So I'd rather us have a discussion than, finish the presentation. So that's what this is about today. This is the perfect timing following Brian, because hearing from individuals themselves and their lived experience is perfect. I always try to start my presentation with a story. So this is a story about Ron. When Dr. Bagrodia asked me to give the presentation, I knew exactly the story I was going to tell because we had worked with Ron previously. This isn't really Ron, but this is Ron's story. So Ron was a husband, a father of 8, so a way better man than I, right? Single income household, and he had a high deductible health plan. So when we met Ron, he had just finished his treatment for advanced stage testicular cancer, and he had chemo. So when we assessed his social and economic situation, he said that he had to stop his regular 9-to-5 job soon after diagnosis and treatment. And he said, "I can't afford my out-of-pocket costs. They're high." And he was worried about his ability to support his family, right? 8 kids and his spouse, his partner, because of those high rising medical bills, right? So he said, these are the things I need help with, right? Medical bills, food, utilities. So thankfully, we were able to connect him with a patient nav, some medical assistance, and then community resources. But I tell this story because this is what financial hardship from cancer is. This is what it looks like. And also, what I like about Ron's story is that it really illustrates the different types of financial hardship that someone can experience. It's not just one thing, right? But I show this definition quickly because I really like what it says here, right? It's when someone's unable to pay for essential living expenses. That's truly what it is. And in this case, I like that they highlight health and welfare of the individual and the family. Because it's not just, you all know this, but it's not just about the individual themselves who's going through that cancer journey. It's the family or whatever that extended support unit is. So these are the different types of financial hardship, at least in terms of how within research, we've kind of bucketed them. And there's not clear lines, right? They can kind of overlap, but this is how we've bucketed them. The material is kind of, I think, what most people think of. Out-of-pocket cost, right? Lost income because of maybe reduced hours at work or lost work. This middle one, this behavioral one, is kind of, think of it as like the steps that people take to try and combat this lost income, right? So it could be, in this case, we kind of put more like medical related steps, right? Some people skip doses. Some people skip chemotherapy appointments or visits, right? Because they're trying to save on these costs or avoid those medical visit kind of copays things, right? Some people take second mortgages on their house, home equity loans, things like that, right? To try to ease up some assets to try to help pay for these bills. And then the psychological response, like we saw with Ron's story, right? He was stressed. He had a family. He was worried, right? How am I going to help pay for my family's everyday needs, I got these rising bills, both medical and utilities, everyday stuff, right? So these again are just the three different types that we see, that we've heard from these patient stories, right? So again, just to say these are the buckets, this is what we hear, this is what we're trying to combat through our work, not only my own and our team's work, but others across the country and the globe, really. This is not just a US thing. So in this study, what we did is we tried to really understand what's the range of sacrifices from individuals' words themselves that people list when they experience financial hardship. So we said, okay, can you provide just a list, again, in your own words? What are the sacrifices that you've experienced? So this is kind of the list that we compiled. And you can see here, it's a long list. This isn't the entire list. It kind of got cut off here. But nevertheless, you can see the range, right? And the important thing that I want to highlight here is that when you're experiencing financial hardship, it impacts all aspects of your life. It's not just about the finances, right? It affects work. It affects your family. It affects potentially your kids' college, right? We've heard stories where kids have had to come home from college because, right, the family couldn't support the tuition payments anymore, right? People have gotten divorced, all kinds of things, right? Again, it's huge. So it's something that's important that we really need to deal with and really try to understand and start to assess within our health system, right? Things that we need to ask these questions as part of routine care, right? It's an important part of the care flow. So this was an interesting story that was specific to testicular cancer survivors. It came out of, I think this was one from Japan potentially. And what they did, what I loved about this study, is you can see they asked individuals who had experienced financial hardship, in this case they termed it financial distress, about their quality of life, different components of quality of life. And they said, and they looked at, as you can see in that little box on the right, they compare people with no financial distress compared to moderate, mild, moderate, and severe. And the severe are in the red. And then they looked at the different levels of how they report their quality of life in these different buckets, right? Treatment side effects, job, education problems, physical limitations. So what you can see is that those who reported having severe financial distress really reported high problems in the job and the education bucket, which was they had high, right? Almost their score in that bucket, if you will, was almost 100, compared to those who had no financial distress, which is in the blue right in the middle there, right? So you can see that it was almost like a step one as you went up in financial hardship, that quality of life got worse in that specific bucket. Same case in the physical limitations. So really what that they highlighted here is that there are specific components of quality of life that may be affected more than others when you're experiencing financial hardship. But also just to say that they're connected, right? People who are experiencing financial hardship may also be, that their quality of life may be impacted, right? And then here on the left, what I show is folks with testicular cancer may be at higher risk for financial hardship because of certain factors, right? A lot of times they're diagnosed at a younger age, so they may still be in the workforce. They may still have younger children at home, and they may be, in this instance, healthier, and so may be more likely to go on chemotherapy, all right? Some of the treatments that others who are less healthy may not be likely to go on. So that sets them up to be potentially at greater risk for financial hardship. So what do we do about it? How do we intervene? How do we prevent this? This is a really good time in terms of the research space. This is a list of trials that are ongoing right now, that are testing different solutions and different types of interventions to address financial hardship. This is just a list. Again, you'll have a slide, but you can look them up. There are different types of trials. And on this next slide, I'll show you kind of the different kind of buckets or things that they are focused on. So here you can kind of see, again, these are the kind of the different areas that they focus on. There's financial navigation, which is kind of a study that we have. There are some that focus on having a community health worker, right? Connecting our patients to someone in the community, looking for community resources. There are some that focus specifically on health insurance, right? Does our patient have the right health insurance, or any health insurance sometimes even, right? Of course, there are some that are focused on health policy, right? Like you've seen headlines in the news too, right? Drug costs, things like that, right? Some of these interventions are focused on employment, right? Having those workforce benefits, having knowledge about them or knowing how to access them. Universal cash transfer. This is a study, an amazing study out of the University of Pennsylvania that's saying if we provide our patients with like a monthly stipend, a flat monthly stipend, does that help, right? So we'll see. That study, I think it's like its second or third year. So it's really getting going now, so we'll see the results. And then these last few on the right, these are more kind of like system-based assistance options that are more routine. These aren't necessarily being tested in a trial, but these are options that we tend to have access to in everyday care, right? Pharmaceutical assistance, or in this one on the right, like a medical financial assistance program, things like that, right? Or nonprofits, whether that's national or local level. In terms of thinking about a financial navigation intervention, right? What do we really need to do, right? It's us as a health system being aware, right, of like, what are the resources here in our systems or outside in the community? Asking, right, as a health system, again, or as a physician, as a clinician, as a healthcare team member, asking our patients proactively, not waiting for a patient or a family member to say, hey, you know what? We're really struggling with the out-of-pocket costs this month, right? Sure, that's a reactive, and there's still opportunities to help, but why not as a system or as a healthcare team member proactively saying, hey, do you have any questions about your medical care costs or anything, right? Again, that proactive approach. It's a better way for us to intervene, adjusting care. If we have this knowledge, right, then there's an opportunity for us to create a care plan that aligns, right, with the patient and the family's financial situation, their circumstance, right, with their everyday real life needs. And then assisting, right, creating a warm handoff. If we have this information, we have a care plan that's really aligned, again, with these needs, then we can assist them. We create these warm handoffs to the right resources at the right time. This is just, again, all these slides came out kind of wonky, so I apologize. I showed this slide. This is kind of a map that we created from a trial, our trial right now, our financial navigation trial, that it really just kind of maps the different types of assistance that we worked on with one of our patients who received navigation over 6 months. And this wasn't even everything. I show this because imagine that, a patient trying to navigate all these different resources on their own without, right, working knowledge of the different systems or without really having help. Imagine if they have, language issues, right? Spanish speaking only, or some other language, right? Which we find a lot. Look at the region where we are, right? I mean, it's not uncommon, right? And then in addition to that, look on the bottom there, right? Unemployment application, right? Or a lot of these, think of like the VA applications. A lot of times those applications, you're gonna get denied often. That's the first thing, right? Is a denial, and then there's an appeal, right? That appeal process. You have to get used to those. And so having someone by your side say, hey, I got you, let's do it again, right? Let's see the application, here's the information, let's do it again, right? It's just having that ability to connect with someone to assist you through that. So again, this wasn't an individual specific to testicular cancer, but there's a likely scenario that could be very, very similar. And that's why I share this with you all. So quick summary, I know I slammed through that info, but I want to get questions or comments from you all, right? So financial hardship, it's just when you're unable to really pay for these essential expenses. There are these three common types. They're overlapping, they're not clean lines, but you can experience all of them, and that's super common. How do we address it? Be aware, ask, adjust our care plans, and then assist. It's a dynamic process. We can't just ask one time and then, okay, we're good. We have to ask over time because care plans change, our lives change, and so we need to consistently ask over the course of our patients' treatment and their care, even into survivorship. And then lastly, we're in a great place. Solutions are here presently, but we're going to be driving to a time period where we have evidence-based solutions that we can really drive forward. And that's really it. I really appreciate you all giving me this opportunity. Happy to answer any questions.